So let's talk about management of colic in infants. One thing you need to know is that colic symptoms resolve spontaneously in majority of infants by 8 to 9 weeks of age. Colic symptoms resolve spontaneously in majority of patients by 8 to 9 weeks of age. The mainstay of colic treatment is caregiver support. Let me say it again. The mainstay of colic treatment is caregiver support. Supporting the parents, supporting the one who is providing care to the infant. Because we learned today that colic is a benign condition. All right. Now, what are some other things you can do to help with colic? Remember when we started, I said that you may want to change the feeding technique. And you may want to try different soothing techniques to calm down the infant. For example, rubbing the abdomen. Number two, providing white noise. And somebody will say, what is white noise? So white noise is, the noise from common household instruments like the vacuum cleaner, like turning on the tap, the noise from the tap, like the air condition, turning on the noise from the air condition. Those things. That's what we call white noise. Or maybe, the dishwasher, the noise that comes from it, because it distracts the child a little bit and it can cause the child to calm down. And you can also do a trial of hydrolysate formula for children who are in formula fed. Okay, hydrolysate formula for children who are formula fed. And one thing, what you have to know so that you are not tricked in your MCQs and your CDMs is that do not switch from cow's milk formula to soy protein formula or using fiber-enriched formula infants. Don't do that. If you have a kid who is on formula, you may want to switch to hydrolysate formula, okay? But then if you see an option which is talking about switching from cow's milk formula to soy protein formula, that is wrong. Let me say it again. If the child is already on formula feeding, you may want to move from that to hydrolysate formula. However, if you notice that you are being told, oh, why don't you switch to something like from cow formula to soy protein formula just to manage colic? No, don't do that. And in children who present with colic, you want to follow up, but the follow-up is individualized, right? There's nothing like follow-up after 4 weeks, follow-up. No, it depends on the severity of the colic and the caregiver stress which is going on. Then you want to make sure that you follow up well. Now we're talking about, how to soothe the baby. So you can soothe the baby with using a pacifier. You can also soothe them by taking them on a ride in a car. Holding the infant and placing them in front of you, right? That's also another thing. Rocking the infants gradually, but you don't want to rock them too hard because of the effect of possible shaking baby syndrome. And you can even change the scenery, where you can minimize visual stimuli. So maybe you can take them to a very quiet room and placing the infant in an infant swing so that as the infant goes up and down, it calms them down. And providing a warm bath and rubbing the abdomen of the baby. And white noise. White noise is what I've talked about, like turning on the tap, the vacuum cleaner, the dishwasher. Those ones, it distracts the child a little bit and it can, get a child going. So another thing, in the children, if someone asks, is colic associated with any neurocognitive developmental delay in the child? No. In the child itself, colic will not do that. However, in the adult, colic can lead to depression and early cessation of breastfeeding. Okay? Depression and early cessation of breastfeeding. And when are you going to refer a child with colic to the specialist? The truth is that many cases of colic can be managed by the primary care physician. So why will you refer? Under what circumstances will you refer? You refer to two types of specialists. Number one, a developmental behavioral pediatrician for the child. Developmental behavioral pediatrician for the child. And for the adult or the caregiver, you may want to refer to a mental health provider because of anxiety. So developmental behavioral pediatrician for the baby, and then mental health provider for the anxious caregiver.